Hello, my name is Dr. Amy Weir. I'm a licensed clinical psychologist. I specialize in the field of early development and also separately in infant mental health. I've been working with the 0 to 5 population for about the last 4 to 5 years. So the model of infant mental health really began with Barry Brazelton, who's a pediatrician, the forefront of the infant mental health field and recognizing the importance of knowing how our babies communicate with parents and knowing that the relationship and respecting that relationship in support of the child's well-being as they grow and develop. And so those that would really benefit from working in that capacity would be mothers who are new and expectant, who have never been a parent before, maybe parents that have a history of trauma or experiences that have been negative in their own caregiving, and high-risk pregnancies in that capacity as well. It serves such a broad range of families and really in service of supporting the child's well-being from a very, very early stage. So the process of infant mental health and working with a practitioner who provides these services involves working with the parent and child together in the dyad. And so a lot of that work involves parents learning how to read the cues of their baby that may be different or may be harder for them to read, or they may be making meaning of them that is not necessarily helpful for that relationship. There's a lot of work with the therapist in understanding where that meaning is coming from, as well as how to interpret how that baby is responding to hunger or sleep, tiredness, dirty diapers, those kinds of cues. And so that there is an effective response and that child then is able to feel comfortable and is attuned to the caregiver, a mutually beneficial process. Attunement is a very important process in early development where the parent and caregiver is understanding and has this inherent knowledge of what the child is needing in the moment, with of course some realistic missteps, thinking about a good enough mother, and that's what we're looking for. With that being said, when attunement is there and is provided within the relationship, that helps to support the child's needs and feeling secure and knowing that there's trust in that relationship. And the basis of healthy development is knowledge and trust in a secure and supportive environment. Knowing that there is an attuned relationship occurring there will help this child to develop in an appropriate manner. So PCIT, it's an acronym for Parent-Child Interaction Therapy, has also been around for quite some time, about 20 to 30 years. It's created for children between the ages of 2 to 7 years old, where they work with a caregiver and having work on relationship enhancement, and then also providing clear directives and support to the parent enacting their own role and authority where they may have felt that they no longer are able to manage their child's behaviors, and is split between those two separate areas. Parents are concerned about their child's behaviors, they can absolutely reach out. First point of contact often is a pediatrician. Pediatricians can absolutely make referrals to mental health agencies or to other psychologists, psychiatrists, or therapists that may be in-house in some way. There are resources through 211 in Orange County, which is an information line to provide additional resources for various different things. For those that have private insurance, always refer back to their insurance provider because on the panel, oftentimes psychologists and therapists will list their specialties, and so they're able to make an appropriate selection for their own needs for the family. And thank you for watching. I hope this was helpful in learning about infant mental health, PCIT services. For more information, you can seek out Therapists in Action.